I recently did a video that was a full overview of all parts of Medicare. And one of the problems was it's about an hour and a half long. So some people have asked that I break it up into pieces to make it easier to find exactly what you might be looking for. So that's exactly what I'm going to do right now. And I'll put the link to the longer video in the description below. But this piece is going to be on Medicare Part B. Gives you a pretty full overview and makes it easy to understand everything you need to know about Medicare Part B. I hope you find it helpful. Stay tuned.
Medicare on video, Medicare on video.
Okay, so moving on to original Medicare Part B. So this will be the section on Medicare Part B, which obviously is different from Medicare Part A. In the last section, we talked about Medicare Part A covering stuff that goes on inside the hospital. Medicare Part B covers stuff that goes on outside the hospital. So important to understand kind of how they function, although when you go to have stuff done, you pretty much give your Medicare card and it knows what's going on. So it's nothing you have to do to make something happen differently inside the hospital versus outside the hospital. Simply present your Medicare card and things will happen the way they're supposed to happen. So when we get into Medicare Part B, it's kind of easy to understand. Another one of our pictures that makes it a little bit easier to understand. And again, Medicare Part B is stuff that's outpatient. So things like medically necessary services, preventative services, doctor visits, outpatient care, preventative care, home health care, durable medical equipment, mental health, clinical research, things like that, stuff that happens outside the hospital. Anything that's inside the hospital, pretty much Medicare Part A. So you can see down at the bottom, same information without the picture. What does Medicare Part B cover? And then probably more importantly, what does Medicare Part B not cover? And inpatient services, so stuff that goes on in the hospital, that's under Part A, also doesn't cover dental, vision, and hearing. And that surprises a lot of people, but it's generally just like stuff you had at work with your medical insurance where you had a separate dental, vision, and hearing plan. And that's the same with Medicare. Dental, vision, hearing would only fall under Medicare if it were like in a car accident or something like that. It's not standard dental coverage or vision coverage or hearing coverage, but there is a separate policy for that. So there are policies designed for people 65 and older for dental, vision, and hearing. We can obviously help with that as well. Medicare Part B, hospice care, prescription drugs are not covered. That's covered under Medicare Part D. And then long-term care, cosmetic surgery. Obviously, long-term care is not covered under health insurance. It's a whole different scenario. So it doesn't cover long-term nursing care, but it does cover rehab in a skilled nursing facility. So medically necessary services are like what they're supposed to be. Generally, Medicare is going to cover anything that's medically necessary. So if your doctor is saying it's something that you need, I don't ever hear Medicare denying something like that. So, and that's on original Medicare. It can be different under a Medicare Advantage plan because decisions are then made by an insurance company versus being made by Medicare. But Medicare, pretty good stuff, and it works pretty much exactly the way it's supposed to do. And, I relate a lot of times in videos where I have thousands of clients and I literally get zero customer service calls. If I get a call once in a month, that's a lot. And it's usually somebody that misplaced their Medicare card and is looking to figure out how to replace that. But for having stuff covered, it's pretty much black and white and works just the way it should. So here I have another video on Medicare Part B, and I kind of go over this stuff, really detailed in Medicare Part B. These aren't long videos. They're maybe 3-4 minutes, but it's a little more detailed of exactly what Medicare Part B is. You can also see a little blue link there for Part A. If you click on any of the blue links, it'll take you to the page that has all the information on whatever the blue link is talking about. So make sure you look through all that and take advantage of it. And will Medicare Part B cover all of my outpatient needs? And the answer is generally yes. As long as it's medically necessary, that's what it does, and that's what it's for. So again, A, in the hospital, B, outside the hospital. So whether it's outpatient surgery, if you're going to, have a colonoscopy or something like that where you're not admitted to the hospital, it's going to fall under Medicare Part B. What are the costs for Medicare Part B? So this is important to understand. So Medicare Part B, unlike A, does have a premium. So Medicare Part B has a premium which is currently $148.50 a month. So it's $148.50 a month for Medicare Part B for most people. That premium is income adjusted. So what surprises a lot of people is if you have more income than you're supposed to have, going forward while you're in Medicare, you're going to pay more for your Medicare Part B. You're also going to pay more for your Medicare drug plan Part D. So important to understand that. It's called IRMA, and it's income related monthly adjustment, something or other. I go through that in a little bit also in this video, so we'll talk about that. But that 148 can go up to as much as $400 and some a month. So it can be significant, especially if it's you and your spouse together. Your Medicare Part B premium can be high. So I think the first line before it goes up is annual income of $70,000. And again, important to understand in how they calculate it, it's based on income 2 years ago, because that's the tax information they have access to is 2 years ago. So a lot of times people made money 2 years ago and don't make as much money now. So you have to appeal that, and I'll show you how to do that. We have the form and the instructions and all that stuff to make it easy, but it's important to understand. So here are some more links in the book where if you click on Medicare costs at a glance, it'll take you to the page that gives you a pretty easy breakdown, Social Security benefits, things like that. And then how do you sign up for Medicare Part B? Pretty much the same way as Medicare Part A. When it is time, you know you're going to come into Medicare, you need to do it early. And if you're going to do it at age 65, it's going to start on the first of the month that you turn 65. So if you're born on June 10th, it's going to start on June 1st, unless you're born on the first of the month. If you're born on the first of the month, it's going to start on the first of the prior month. So if you're born on June 1st, it's going to start on May 1st. So if that's the case, if you are a first of the month baby, then you need to set this stuff up super early, because it's going to start 30 days ahead of when you actually turn 65. So make sure you understand that and get it done when you need to get it done. So here's that Apply for Medicare button again. If you're in the book, you just click on it, and it's going to take you right to the page on Social Security of where you sign up for Medicare Part A and Medicare Part B. It's really not too complicated. And believe me, you want to do it online if it's at all possible, because these days trying to call or make an appointment or things of that nature can just get really, really drawn out, long wait times, things of that nature. So if you can do it online, click right there, do it online. And then what does Medicare Part B not cover? And again, doesn't cover the stuff that Medicare Part A covers. Doesn't cover things that are inside the hospital. But outside of that, pretty much, as long as it's medically necessary, it's obviously not going to cover cosmetic surgery or things of that nature. So, it's pretty easy to figure out. And again, it works just like it's supposed to work. So very few complaints on how Medicare A and B work, with the exception of maybe some out-of-pocket costs, or if you got to pay more premium for your Medicare Part B. Obviously not good stuff, but we need to understand it so that we don't have any surprises. So what are your out-of-pocket costs for Medicare Part B? So Medicare Part B does have an annual deductible. It's $203 a year right now. And that goes up usually a few dollars every year, but $203 deductible annually, runs January to January. You pay it once per year. Chances are, if you're coming off health insurance right now, you have a $1,000, maybe even a $5,000 deductible. So $203 annually, pretty small for medical coverage going forward. Once you have that deductible paid, Medicare pretty much goes into 80-20, where they're going to pay 80% of the bill. You're going to be responsible for 20% of the bill, which is actually pretty good. That's kind of how insurance used to be in the old days. You had 80-20 coverage, where you're responsible for 20% of whatever is going to be charged. Now, with Medicare, if you have a supplement plan, it's likely going to cover that 20%. So you're likely to only have that $203 deductible for the year for anything that's outside the hospital. And then the supplement's going to cover pretty much all of the out-of-pocket for in the hospital. So again, super low out-of-pocket on Medicare, you can have a slightly less Medicare supplement plan that might add a $20 copay when you go to the doctor. But again, very, very good on the out-of-pocket expenses for Medicare A and Medicare B. So what is the late enrollment penalty for Medicare Part B? You want to do it when you're supposed to do it, because if you don't do it when you're supposed to do it, they do give you a penalty. And there's a 10% penalty annually for every year that you waited. So if you're supposed to sign up for Part B, now keep in mind, if you're on regular employer group coverage called creditable coverage, then you do not have to sign up for Medicare Part B. If you are not on creditable coverage, you do have to sign up for Medicare Part B. Actually, you don't, but if you don't, there's going to be a penalty when you do. So what a lot don't understand is employer retiree coverage is not considered creditable coverage. So if you're on retiree coverage, you work for a big employer and they provided retiree coverage, and then you go into Medicare later, you're going to have this penalty because it's not considered creditable coverage. Also, COBRA is not creditable coverage. So if you're on COBRA, you need to come off of COBRA. You're probably paying an arm and a leg for the COBRA. Come off of the COBRA and go into Medicare when you're supposed to go into Medicare, or else there will be a penalty down the road if you go into Medicare later. So here we are again, and please leave a comment. So my throat's getting a little dry talking about Medicare. I'm hoping the least you'll do is leave a comment below the video. Helps everything just go a little more viral and gets the video out there, and it's a big help to me to get YouTube to say, hey, yep, we need to show this to more people because it's good information. So just take a minute. I'll respond to every comment personally. Put something good, put something boring, whatever you want to do. Sounds good to me.